Hello, I want to spend some time today talking about hygiene during pregnancy. We'll cover just a few different topics. I want to discuss a little bit about just hand hygiene, and then dental hygiene, vaginal hygiene, and then breast or chest hygiene. So, just to kind of start off with hand hygiene, hand washing is one of the most important things that we can do to prevent the spread of germs and infections. Washing your hands properly is something that people probably don't do often. You need to use soap and water. You need to wash your hands for at least 20 to 30 seconds and making sure that you are washing all surfaces of your hands. You need to wash your palms, you need to wash the backs of your hands, in between your fingers, and then scrubbing your fingernails if possible, and even going up on your wrists. And then you want to rinse and use a clean paper towel to turn off the faucet, and then open the door if you are inside of a restroom. We've also gotten into the habit of using hand sanitizer often, and that's something that you can carry with you. And it's great to have if you're in a position where you maybe need to wash your hands, but you don't have access to soap and water. So it can be used and it is somewhat effective, but do not rely on it all the time. Times that you want to wash your hands are after you go to the bathroom, before you prepare food, before you eat, after you've prepared any food, touching animals, changing dirty diapers, anything that your hands could come in contact with germs. Something else that kind of goes along with hand washing is right now with COVID is taking precautions to reduce the spread of upper respiratory germs. And so wearing masks is helpful. The hand washing also helps with that. If you're going to cough or sneeze, you want to cough or sneeze into your arm or a paper towel if you have it, and then wash your hands and then throw that away. As far as dental hygiene goes, dental care is safe during any trimester of the pregnancy. Um, we really encourage people to still get their checkups and their cleanings while they're pregnant. One of the things that happens often during pregnancy, because the baby is taking so much calcium to develop their own bones, that ours tends to lack a little bit. And so it's not uncommon for someone to have really great teeth before they get pregnant, and then after the pregnancy's over, go back and find out that they have several cavities. So we recommend continuing to get those cleanings and checkups while you're pregnant. If you have any kind of abscess, things, something that's really painful that ends up needing to be taken care of, that you need to have a root canal or an extraction or something like that, those things can and should be done during pregnancy. We don't want to take any risk of a infection getting into the bloodstream because it can be fatal. Sometimes you may need a note from your healthcare provider to your dentist letting them know that you are under care of a health provider for the pregnancy, but they are aware and that you can get those needed things done. Also, they say that x-rays are not something that we're supposed to be doing while pregnant, obviously, but they do have the lead aprons at the dentist's office that they can put over you, and that does greatly reduce the risk of any radiation harming the baby. Something else that is very common during pregnancy is for your gums to bleed. And so this is just from a little bit of inflammation and also from hormones. So if you notice that, just know that it is normal during pregnancy, but it also can be a sign of, bigger dental problems. So you want to make sure that you are brushing your teeth and flossing every day, at least a couple of times a day, preferably after every meal if you can. If you have a condition during pregnancy like nausea and vomiting or hyperemesis gravidarum, where you're really throwing up a lot, we recommend that anytime you throw up, you at least rinse your mouth out with some just plain water. That kind of helps to get that acid off of your teeth from throwing up, and so, but then brush them if you can. Moving on to breast and chest hygiene, one of the things that you will notice during pregnancy or could notice is that you start to leak colostrum even early in the pregnancy. This is a yellowish, whitish like oily substance that you will see coming out of the nipples. This is completely normal and is actually very good for your tissues. Um, you don't want to continually like wipe that away, or be wiping it off with a paper towel, because then we are extracting more oils that are naturally there out of our tissues, out of our skin. What you can actually do with that colostrum is just kind of rub it in, almost like a lotion. Rub it in on your breasts and just let it air dry. When you are bathing, do not scrub your breast or your nipples with anything. Don't use, soaps or any harsh cleansers. It's best just to wash your breasts or your chest with a soft washcloth, with just some warm water, and then pat or let air dry. Um, Moving on to vaginal hygiene during pregnancy. First, I would say that think about wearing loose fitting clothing, nothing tight. Cotton underwear are more breathable. You're going to have some discharge during pregnancy, and even not when you're not pregnant, and this is very normal. This discharge helps to clear out and clean out our vaginal tract and helps us stay healthy. So that leads to conversations about douching. This is actually more detrimental than it is beneficial, because when we do that, we are clearing out the good bacteria and flora that are normally there that keep our vagina healthy. So this is not recommended. When you use the restroom, make sure that you wipe from front to back, not back to front, because when we do that, we're introducing more bacteria. You want to urinate before and after sex. Do not hold your urine anytime you need to go to the bathroom. Take that break. And if you notice anything like foul discharge, smelly discharge, itching, burning, you need to let your healthcare provider know.